start now خلاص by Professor Dr. Afaf. Okay, let's start.
Let's start. طبعا welcome Dr. Nashwa. This is our first meeting, and I hope it will continue further, inshallah. Our objective today. Let's start it with the article itself. It's called "The Art and Science of Brain Care in NICU." My objective is the critical period of brain development, factors influence brain development and toxic stress, and the effect of prematurity on brain development. If we see in the fetal life, you will see that the brain development, the fetal life is started. Can you mute yourself, please, doctor? Can you mute yourself, please? Thank you. It started from 25 days, and the brain looks like the coffee beans. It's very tiny, very small. And when it reached the baby or the fetus reached the 5 months intrauterine life, the brain started to be biloop, but it is smooth, very smooth, and it is primitive with primitive structure. And then you can see that in just in 4 months later, 5 months till 9 months intrauterine life, the complexity of the brain of the fetus with sulci and gyri, cerebellar, and all the complexity of the brain just in the 4 months apart from the 5 months till 9 months of intrauterine life. And we have to see that the brain development during infancy is fascinating. Usually the newborn at birth has the brain volume with 400 grams, but at 1 year it becomes 1 kilogram, 1,000 grams. And by 2 years of age, the brain reaches 80% of the adult brain size. Look at the rapid development of the brain in the from the conception till 2 years of age, which is called the first 1,000 days of life, which are very important, and this period, it is called the window of the brain development. You can see also the most rapid period in the brain development and the period of highest plasticity in the last trimester. And you can see that the cell birth, the migration, the axons and dendritic outgrowth, the programmed cell death, even synaptic proliferation and myelination, it occurs from conception or the mid trimester till the 2 years of age. Of course, the myelination is completed afterward till the adult life, till I think the puberty, till 18 years of age. We can see also that the density of synapses in the brain from the mid gestation and then birth occurs, and then also it continued to be crescendo, increasing in the synapses and in the myelination through the 2 years of age. So all this period is called the first 1,000 day of age, which are a very important days in the brain development. So there is a rapid proliferation of the neural connection in infancy, as many as 15,000 new connections per neuron and 100 trillion synapses by age 2. Look at the fascinating and the pruning of the nervous system and of the brain in the first 2 years of life, or from conception till the first 2 years of life. So this pruning make the brain more efficient by eliminating underused connection afterwards. And through the brain and within this brain, there is some critical areas which are very important in the learning, in the memory, in the critical thinking of the babies afterward, which is the prefrontal cortex, the hippocampus, and the amygdala. The hippocampus and amygdala, they are present in the two small structures are present in the temporal area or the limbic, it's called the limbic area, and of course the prefrontal cortex. Why they are important, you will see now. The frontal lobe or the prefrontal cortex are very important in the abstract thought, in the reasoning, in the judgment, in the planning, in the regulation and consequences. So it is important in the critical thinking itself. And the temporal lobe, which is contain temporal lobe and limbic system, which contain the hippocampus and amygdala, they are important in processing sound and the language, and for the emotion, impulsivity, and the memorization, mood, all of these, or even the behavior. They are all of these are the function of the amygdala and the hippocampus. Again, there are some rapidly growing nerves in the brain of the fetus. They are the vision or the sensation as a whole, but the most important are vision and the hearing. And in our Holy Quran, you know that in Holy Quran, Allah mentioned Sam'a wal Absar. So they are very important and very rapidly growing nerves, vision, hearing, language, and the higher cortex or higher thinking. So what are factors affecting brain development? Let's see. Of course, it started from the maternal period. The maternal period or the perinatal period, prenatal period, which is the nutrition for the mother, the stress of the mother, the immunology of the mother, the microbiome of the mother. All of these can alternate the brain development of the fetus. And then after birth, of course, the environment around the fetus, the environment, the experience. And I think that we will hear more about the experience and the environment in NICU or outside the NICU from Dr. Nashua. So neurodevelopment outcome, uh, uh, brain development. Brain development is it's affected by genetic factors, could be the genetics of the mother, genetics of the fetus itself, hemodynamic factors, nutrition factors, immunological factors, or during delivery by brain injuries, or by external experience and stimuli for of the sensory organs. So what shape the brain structure as a whole is genetics, environment, and experience. These are the three main things that structured or shaping the brain architecture. So what about the stress? And what causes stress to the developmental brain? What is stress? We have three types of stress. We have a positive stress because all of us are living in stress while we are in the womb of the mother. We are living in stress. So stress is very important for our lives. But we have three types of stress: positive and tolerable stress, and then toxic stress. Positive stress, which is normal and essential part for healthy development, like what in the infant, like or in the babies, like while they are going to take the vaccine. So it is a stress, but it is a positive stress. There is a hormonal regulation at this positive stress. And then we have tolerable stress, like a loss of loved one, or a broken bone, or the baby hidden by anything. This is a tolerable stress. But what about the toxic stress, which is the main issue in our presentation today. The toxic stress is experiencing strong, frequent, and prolonged stress all over the time. So it is this toxic stress can cause emotional and cause brain development abnormalities, or even changes in the architecture of the brain. So what is toxic stress? Is strong, frequent, and prolonged stress without adequate support. There is no support. This is very important, because tolerable stress, there is a frequent stress with adequate support. But without adequate support, this is a toxic stress. This result in potentially permanent changes in gene expression, in brain development, and in behavior. Why? If we look at the stress itself, it affects the hypothalamic pituitary adrenal axis. This is what's called mineralocorticoid receptor. It's present in the hippocampus, and glucocorticoid receptors present in the hippocampus and amygdala, which are responsible for emotions, responsible for the mood or the behavior, and responsible for the memory. So this stress, when started to stimulate these receptors as well will stimulate the hypothalamus, and the hypothalamus will stimulate the pituitary to produce adrenocorticotropic hormone. And this adrenocorticotropic hormone from the stimulate the adrenal cortex to produce the corticosteroid. So corticosteroid will produce an excessive dose, prolonged excessive dose, and this prolonged excessive dose of cortisone versa, it will affect the hippocampus and amygdala, and it affects the structures of the hippocampus and amygdala and other structure like prefrontal cortex. It's very important in the critical thinking. So these areas, amygdala, hippocampus, prefrontal cortex, all of these will be affected by the high cortisone level, which produced by the adrenal gland. Let's see here that prefrontal cortex, the maturation of prefrontal cortex will be affected by the high level of cortisol. Amygdala, elevated cortisol level will cause, also will affect the activity, affect the maturation in the first years of life. Hippocampus, the same. The high cortisol level, it will affect the growth and the performance of the hippocampus level. So toxic stress, increase the cortisol and norepinephrine, it will change the brain architecture. And this change of the brain architecture will affect the behavior afterward, will affect the mood, will affect the memory and the critical thinking. Look at the by electron microscope. If you see the brain architecture of the neuron, this is the normal neuron. Look at the brain which exposed to toxic stress. There is interruption of a beautiful network here. So there is interruption in this the neuron and the network in the prefrontal cortex and in the hippocampus and amygdala. The three important structures in the brain. This is another imaging. I think it is the map or brain map or something. بتهيألي مروة هتبقى عارفة والدكتورة نشوى. This map. Look at this is the healthy brain, and this is a brain which is exposed to a toxic stress. Look at the temporal region. The temporal region, which is the limbic region under which contain the hippocampus and amygdala. Look, they're typically deficient in the connection, in the even the impulses in this brain. So toxic stress, it will affect the cause epigenetic modification, cause interruption of the brain architecture, and of course it will affect the behavior, with maladaptation and a non-communicable disease. Why? Because the cortisol, when it is increased in its level, it affects the cytokines, it affects the immune modulation in the fetus itself. So what is NICU stressor? Of course, uterine, the baby while he is in the uterine environment provides modulated rhythmic sensory input that support the optimal brain development and maturation. And of course, loss of this modulated environment lead to haphazard and unexpected sensory input with no regulation. Well, I mean, if the baby is exposed to some haphazard environmental disorders, and Dr. Nashwa will stress on this point. NICU stressor could be the critical illness, could be pain, could be from ambient noise, light, lack of support, lack of skin to skin, lack of nutrition, or to leave the baby unattended, crying, unsupported, and interrupted sleep. So the conclusion is that sustained activation of the stress response system can lead to impairment in learning, memory, and the ability to regulate certain stress responses. And thank you. This is my introduction.
دكتور عفاف، نحب نوجه لحضرتك بس نقطة. As regards the brain development in preterm and full-term baby, is there any difference in these stressor factors regarding the prematurity and how prematurity affects the brain development?
Okay, this will make me to increase just that in prematurity, you know that the preterm, this very illustrative photo or a diagram, which here the brain development through the fetal life. Look at that, 3 weeks of age, the neural tube formation started. At 10 weeks of age, there's a basic brain region formation started. At 13, neural migration started. 15, and so on. So when the baby is delivered prematurely, of course, the synapses will be affected, or the structure formation would be affected. So the premature will disturb, there is suppression of neurogenesis, there is decrease in myelination, and cause a white matter disturbance according at which age the delivery occur. Is it occur at 20, 25, 27? So at specific age, there is a specific insult occurs in the brain. Thank you.